I did everything I could, I think, at the beginning to try to get rid of cancer. Cancer clearly didn't want to get rid of me, so here we are. After I've had a scan or I've got a scan coming up, I'm always very anxious about what the results are going to be because these are what determine treatment plans moving forward. So depending on what the results are, it could change everything that we're doing. Tumors could have grown or not grown. So it just depends on what's happening. But I always have some anxiety around that waiting time period between when I have the scan and then when I actually get results. My name is Sarah. I moved out here to actually move to the mountains. I lived in Lake Louise for 10 years. I worked on the front desk at a very large hotel, and I would quite regularly get screamed at by customers. I'd have keys thrown at me. I'd had all sorts of things happen. You smile and take it. The background that I have in customer service and dealing with the nasty people of my life has helped me be able to deal with stress a lot easier. My stress now is definitely my cancer and, where it's going, how that is all going to play out. I found a lump in my breast, had a biopsy, and then found out I had breast cancer, and that was actually not as stressful as probably the stage 4 diagnosis, I guess. Basically, I live on a 3-month to 3-month rotation of scans, so my scanxiety, I guess, is my biggest stress. Waiting for the next scan, waiting for the results of those scans to know where we're going next with treatment. I actually don't remember our first encounter. He was interesting, he was funny, he was entertaining. He definitely captured my attention in that respect because, as I said yesterday, he is hilarious.
Nothing to say.
When I first met Glenn, I didn't really know what to think of him. He's kind of a goofy guy. I could tell that he was really intelligent, but his humor was a little bit weird, and I didn't know if I believed everything he was telling me all the time.
Oh, he's sarcastic. Oh my gosh. But
Dark.
Dark, yeah, definitely dark. But that's part of his charm, and that's what makes him unique and makes him interesting, and always makes me laugh, no matter what.
I met them through my ex-wife, actually. Glenn was looking for somebody to take on projects with his rental properties and stuff. So at the end of the meeting, we ended up going for a drive in Glenn's car that he had recently modified. So I had just met this man and he was like, hey, here's the keys, let's go for a burn down Deerfoot. And we kind of just started hanging out after that.
The cars are a big part of the family. They just enjoy cars a lot, and they share that joy with me.
In my younger years, I didn't think I would have an interest in cars, as I was primarily a computer nerd, but it's kind of grown ever since, and she's been an absolutely terrible influence on it.
Yes, exactly.
We were driving one day, and a random thought went through my head, and I said, I'm thinking I might go to a Porsche dealership. And she instantly perks up and says, "Today?"
Yes, let's go.
Then that's not appropriate wife behavior. That is, you're supposed to put the brakes on that.
Yeah, that didn't work out for the
No.
first Porsche, unfortunately, because I said, let's buy the Porsche. And then the second Porsche, I said, happy birthday. Here's your Porsche.
Sarah was actually my boss. She hired me for a job here in Calgary when I was living in Ottawa. I would describe our friendship as, it's hard to describe because it did start out more professionally, but it's grown over time that she's become a mentor to me. And then over the years, we just grew closer to the point where she actually came to Europe with me for a veterinary conference, and we traveled around Europe for 2 weeks.
The travel bug is me, for sure. I've always been the traveler. I picked up and drove myself to Lake Louise, and then picked up and drove myself to Alaska, and then picked up and drove across the country, and then got on a plane and went to Australia by myself. Because
I have no idea how she does that.
that's what I do.
My first impression when I met Sarah was, what is she doing with Glenn? I didn't mean that like in a rude way, but Sarah was very intelligent, really pretty, and she was with this kind of doughy, overweight guy, right? That was the first impression, but then you realize that they got along really well together.
I didn't think we were that sickening.
Everyone says that we're quite cute, but we're not cute. Like we're, again,
We don't PDA.
yeah, we're not the big, again, back to the traditionalists, that's not who we are. But definitely, we're definitely close. And this has brought us closer. I mean, yes, I've kind of lost some of my identity, but, you know, I got new boobs, so, you know, as Glenn calls it,
The uninstall and upgrade.
that's what he calls my mastectomy and my reconstruction. But that was an easy decision to make for me. I didn't even spend more than a day on that decision, to be honest. It was pretty much instant, this is what I'm doing. And I was just very pleased that my surgeon was willing to do what I wanted. Sarah speaking. Hi, Dr. Nixon. Is it okay if I put you on speakerphone? Thank you.
So I first met Sarah in 2018 when she initially presented with an earlier stage breast cancer. And so the mainstay of treatment at that time would be surgery. We actually did a test on her tumor to see what her likelihood of recurrence was. And based on that initial test, it looked low risk. And she was put on just an anti-estrogen-based pill.
For those cancers that are endocrine sensitive, endocrine blockers or hormone blockers stop the ability of the estrogen to feed the cancer. And by doing that, stop the cancer growing. So my name's Karen Gelman, and I'm a professor of medicine at the University of British Columbia. Although there's one word, breast cancer, there's multiple different kinds of breast cancer. Even within the broad classifications we talk about, those that are hormone sensitive versus those that aren't hormone sensitive, by understanding those different kinds of breast cancer, we can start to think about how to treat each of those kinds, and then start to think about, with precision medicine, how to treat each person as an individual.
And your blood work is also perfectly normal. So
Oh,
that's
good.
The blood work you had on Monday, I guess it was.
Yes, right. Okay, perfect.
Yeah, so everything looks good.
About a year later, she found armpit lymph node or an axillary recurrence that was positive for breast cancer and looked differently than her initial breast cancer did, in the sense that it was a HER2 positive type of breast cancer, whereas her initial pathology was not that type.
Every cell of our body has a gene called HER2. When there are too many copies of the gene, the cell becomes revved up, and it's like the HER2 is the engine.
I asked about what treatment was available, obviously, what the options were. Initially, we were going on a very different path than the one that we went on. We were going down the hardcore chemo, this is gonna kill everything in your body, and
It was more of the Hail Mary.
Yeah, that was a scary conversation.
Yep.
Chemotherapy is a word that many people get horror with. What does chemotherapy mean? It just means drug therapy. It was initially discovered in the mid-20th century when people noticed that mustard gas caused white cells to come down, and it was originally used to treat leukemia. But in the 1950s, people started using chemotherapy for solid tumors. Despite the fact that people shudder when they think about chemotherapy, we have to remember that chemotherapy means lots of different drugs with lots of different activities and lots of different side effects. We also have to realize that the different side effects can be treated. Many people, both women and men, get upset with the idea of hair loss, but not all chemotherapy causes hair loss. Not all chemotherapy causes side effects, and we can treat the side effects. The goal of chemotherapy is to kill the cancer cell, and many chemotherapies can be very effective at doing that.
I think it was because I'd gone HER2 positive that we changed the course of what we were going to do. At the time, I was just shocked that it had changed, and I asked, does this happen? And she said, yeah, when it comes back, it could be different than it was initially, and I didn't realize that your body could do that.
In the past, those HER2 cancers were considered to be more aggressive and had a much worse outcome. In the last 20 to 25 years, new drugs have been developed, which are anti-HER2 drugs, and they're very effective for the vast majority of women who have HER2 positive cancers.
We planned on treating her again with surgery to remove the axillary lymph node, but unfortunately when we were doing staging investigations, found that she had some disease in her liver, which at that time made her metastatic disease.
As soon as she said, it's metastatic, I tuned out from the rest, and it was a phone call. It was a hard conversation to have on the phone.
We had done everything we possibly could to avoid it. However, cancer doesn't care. If one little cell is in there and it latches on, it can become a lot of little cells.
In metastatic disease, it is a lifelong treatment because we can't cure metastatic disease. We know that those patients will be living with breast cancer for the rest of their life.
On 4 out of 5 brain scans, you've had new tumors.
Yep. Which is scary.
Yes.
But I know that they can treat them, and my radiation oncologist has been very good about telling me that they can do this infinite numbers of times on my brain. So aside from the big tumor was in my cerebellum, which controls all your motor things and your balance, and that's why I was dizzy for 10 months. But I've been lucky that the rest of them have just sort of popped up in different places in my brain, and it hasn't been an issue.
So this area basically, the surgical cavity previously treated, and the same thing here. This one is the right occipital lobe metastasis we previously treated. It's just a tiny bit bigger, but that can fluctuate in size after radiation.
Okay.
The new area is this one here. You can see previously that's a vessel there, so it's a bit subtle because there's a vessel, but basically this is the area that's new here. Okay.
Ah, okay.
Yeah. And your optic nerves are right there.
Yeah, I was gonna say it's close, okay.
Yeah, so that's the area we're treating. Yeah, and that is new from before.
Okay, let's go. So we're on our way to the South Health campus. Treatment is to keep the cancer from going into my bones. So that's usually the next place that it goes from your major organs, it goes into your bones. So hopefully we'll be on time today and we'll be in and out pretty fast. Glenn will come to chemo with me tomorrow, and he can actually go in and sit with me.
Yep.
Whereas today, they won't let him in. I get to go by myself today.
Eight years ago, I had a friend die at the age of 40 of the exact same cancer that Sarah has. And she was taken by it because some of the immunotherapy drugs did not exist then. And it took her 8 months to go from a highly intelligent, driven, vibrant woman and then gone.
I never really watched car television before Glenn. Glenn introduced me to, well, it was Top Gear back in the day. Amazon picked them up and started the Grand Tour. I stalk them on Instagram and find out when they're going to air the show and plan a night around it. The hosts are hilarious. That's the biggest reason I like the show. But I really enjoy the new format of the show because it is a travel show. They travel to somewhere in the world and play with cars, which kind of combines my two loves, cars and travel. We make a night out of it, you know, get our snacks and hang out, watch the show. It's hilarious.
It's absurdist British comedy.
Yes. You got parking?
We've got parking, we should go.
Oh, okay.
Recently, there's been the development of what we call drug conjugates, where there's a targeted agent, such as an antibody, linked to a chemotherapy drug. By putting the two together, we think we can target the chemotherapy to the cancer cell and have it be more effective and possibly less toxic.
Even though we are treating an incurable disease, we're starting to see things like complete responses to some of these antibody drug conjugates. And with HER2-positive metastatic breast cancer specifically, there's been a lot of new targeted agents developed that both improve duration of life, but that also provide our patients with significantly less toxicity, so that when we talk about living better for longer, we're really providing both of those things with the same drugs.
One of the things I'm nervous to ask her, if I ever will ask her, is if she's afraid of dying.
Prognosis is definitely one of the most sensitive topics that we talk about. Really, no human can tell how many days we have left, but in order to help you plan, this on average would be what we would expect. But based on these specific pieces about your case, I would expect you to be on this end of average, which can be oftentimes better, but sometimes not so good.
It's like on cue, he's gone. Good girl. Stay. I don't know. I've never really thought about giving myself permission to be okay with, you know, lying in bed. There are things I can't do anymore, and maybe I'll never be able to do again. I always have things that I want to get done because that's part of the methodical part of my brain that, you know, wants to tick off the boxes and get the to-do list done. We hope that things will get better, but
We'll figure out what we can do.
exactly. Having other people do things, depending on what it is, I'm okay with. Like you know, Glenn's an awesome cook, so he gets to make dinner every day. But I guess I let some people help me. It just depends on what it is. I don't like to ask because that's part of my independence.
I know, and I appreciate that you asked me. We took us a while to get there, too. It wasn't just cancer that did that, but there were other things. Dinner for you.
Thank you.
You are welcome.
Today we're at the Sue Higgins Dog Park. Unfortunately, Sarah's not with me today. She's not only recovering from her chemo yesterday, but the slipperiness just makes it absolutely impossible for her to come down here.
To my knowledge, Sarah's never asked for prognostication. I know that a couple of doctors have surprised her with prognostications that were not asked for, and they were fairly bleak. Her surgeon, shortly after removing her sutures, just flippantly said, well, this will give you another year. To which she said, of what? Life. She's like, from when? Well, from now. And that was 12 days ago, was her year. For the 3 months leading up to the 1-year anniversary of her prognostication, she was terrified. You know, this anxiety is one thing, but having a doctor spit out something that was never asked for and that clearly wasn't true did nobody any good whatsoever. And that's part of the reason why we haven't looked at prognostication, because it plants a flag on the hill and says, you're not passing here. The entire time working up to that is basically planning to die. And that's a waste of it. You know, are we gonna get our affairs in order, get wills written? Absolutely, we're doing that, but that's just good planning anyway. Had I been in the room with the doctor when he just flippantly blurted that out, I would have been exceptionally profane with him. Because unless somebody is explicitly asking you, how long do I have, do you think? Just keep it to yourself. Nobody wants to waste any part of their life planning to die, especially not someone who is trying to recover. Does that mean that we can't have a grand future plan for sitting on the porch when we're 80? No, but who can? There are plans, there are treatments, and whenever she's got anxiety around scans, I have to remind her that nothing is a thing until it's a thing.
We can only control what we can control. And that's been probably my biggest life lesson through this. Cancer does whatever it wants to.